In this video, we are going to walk you through the panoramic radiograph exposure process, including the basic introduction of panoramic machine and panoramic radiograph evaluation. Panoramic signature oral technique play outside the mouth, resulting image show the wide view of maxilla and mandible, used to examine a large structure on a single projection. Panoramic imaging can help us evaluate the dentitions and supporting structures, evaluate wisdom teeth impacted, partially impacted, evaluate eruption, growth, development patterns, detect disease, lesion, and condition of the jaws, examine the extent of a large lesion, evaluate trauma. However, due to the lack of sharpening compared to the intraoral imaging, it is not appropriate for diagnosing caries, periodontal disease, or assessing periapical lesion. Right on the picture, that is on and off buttons is to turn on and turn off the machine before and after using it. This is the control panel. The P1 that already setting up in here is the standard mode. We also have few other modes which are P10, PC1. P10 it reduces the field of view to the mostly the dentitions, good for children when the structures well beyond the zone of dentition are not needed. PC1 to pad shift further away from the patients, useful if the patient have large shoulder, so the machine does not bump them when rotating. KV and MA are the programs depend on the mode and patient size selective. Exposure time is standard constant because they cannot control how fast the machine move around. Like key button, lateral head support button, forehead rest button, X-ray buttons, notched by block. This is the overall of the panoramic machine. We have receptor, has positioner, X-ray tube head, and the exposure control panel. And this is the movable lat wall.
Please review the additional video to follow current infection control protocols. It is important that equipment preparation must be completed before prepare the patients for exposure. To begin, ensure the R button on the control panel is checked for any blinking. If it is blinking, follow the manufacturer's instruction to press it in order to reset the machine before use. Provide a brief verbal introduction to the patient, explaining that during the panoramic X-ray process, they will stand still while the top head and receptor move around them. It is very sensitive to positioning, so the patient shouldn't move until they hear 3 beeps. That will take around 30 seconds, and wait for the clinician to release the head stabilizer, and just for the patient will not be surprised before the actual exposure. Next step, we can kindly ask the patient to remove any metal from the neck or above, such as glasses, jewelry, earrings, piercings, hearing aids, or any removable intraoral prosthesis that may interfere with the procedure, and put it in the plastic cup so that will be easier to give it back to the patient once it's done. Failure to remove any metal objects before exposure may result in a ghost image, and we will show how the ghost image later in the video. After make sure all the metal objects on patient are removed, the clinician will use their clean bare hand to place lead apron on for the patient. Unlike lead apron for intraoral X-ray, the lead apron for panoramic doesn't include a thyroid collar. In PAN imaging, the primary beam is directly slightly upward, resulting in negligible radiation exposure to the thyroid gland. It is a double-sided lead apron designed to protect the patient. To avoid blocking the X-ray beam, the lead apron should be positioned lower around the neck. When placed in the lead apron, the clinician will assist the patient by putting it on from the back. Make sure the whole one piece side is on the back and two pieces are in the front like a cape and should not be overlapped too much. Afterward, we will direct the patient to approach the machine, standing in front of the yellow bar block, using our foot as a guide for them, and we will ask the patient to stand with their shoulders back and as straight as possible. Meanwhile, crossing their hand to hold the handlebars. This will help us properly adjust the height of the yellow bar block. Make sure it is just below the lower lip. Then have the patient tip the head down slightly to bite. This should line up the Frankfurt plane parallel to the floor with minimal adjustment needed after that. The patient will then bite edge to edge within the groove and close the lip between the bite block to prevent a dark radiolution shadow that results in obscure anterior teeth. Following this, they should swallow, place the tongue against the palate, remain still, and we should remind the patient to breathe through their nose. Sometimes patients will turn their heads around during the exposure to watch the machine move. Therefore, we should also tell them that to look straight ahead, and please note that the patient can keep their eyes open since the patient will tend to move more and lose balance and feel uncontrolled when they close their eyes. To make sure that the patient's position is properly, the clinician will pay attention to the lights that show two planes, and it can be seen in the mirror on the machine. But please make sure that the light does not get into the patient's eyes.
First, we need to adjust the two planes that perpendicular that show by the light on the mirror. First plane will be sagittal plane. It is term used to describe the vertical, which runs down the middle of the patient face, dividing it into two equal parts and should be positioned perpendicular to the floor. Second, we need to adjust the Frankfurt plane. Frankfurt plane will pass from the bottom of patient eye socket, which is infraorbital rim, through to the top of the tragus. When both planes are aligned, we are going to process the X-ray. Say X-ray, press and hold for the duration of the exposure until you hear the 3 beeps. If you let go too soon, an error message will occur and the image may need to be retaken. As the exposure begins, the X-ray tube will rotate around the patient's head. Position directions for two parts of the machine. The movement of X-ray tube allows for the image capturing the entire dentition. Exposure time may vary by unit, but generally instead is the MA and KVP that vary from exposure mode and patient size. The X-ray process is finished. Move the lid wall, put the remote control back, adjust the head stabilizers, and have the patient step back. Then remove gloves to take off the lid apron for the patient. Perform hand hygiene. When the patient is clear of the machine, you can press the reset button to return the machine to its start positioning. Patient's mid-sagittal plane not positioned perpendicular to the floor. It may indicate improper positioning of the patient during imaging. Common cause of this misalignment include incorrect placement of the chin rest, head tilt, or failure to maintain a stable head position during imaging. To correct this issue, the clinician should carefully reposition the patient to ensure that the mid-sagittal plane is perpendicular to the floor before capturing the panoramic radiograph. This may involve adjusting the position of the chin rest, instructing the patient to stretching their head position, or improving additional support to stabilize the head during imaging. Patient's chin placement is too low. Frankfurt plane downward error. Patient is positioned such that the chin is too low or tripped down, resulting in the mandibular incisor appearance, Jack-o'-lantern appearance. a loss of detail in the interior apical region occurs. The mandibular condyles may not be visible. An exaggerated smile line, curved outward, is seen on the image. To correct this error, the clinician must carefully position the patient so that the Frankfurt plane is parallel to the floor. Chin is too high, Frankfurt plane upward, reverse smile line. The condyles may not be visible or may appear near the lateral edge of the image. A loss of detail occurs in the maxillary incisor regions. To correct this, the clinician must carefully position the patient such that the Frankfurt plane is parallel to the floor. Plane must pass from the bottom of the eye socket through the top of the ear canal. Lid apron is dropped too high on the patient. Result: triangular opacity on the bottom edge of the radiograph. To correct this issue, the clinician should use a double-sided lid apron without a thyroid collar and drop the apron down around the neck and back area. Lips did not close. A dark radiolucent shadow results that obscure interior teeth. This area of increased darkness occurs over maxillary interior regions and may be mistaken for bone loss. To correct this error, the clinician must instruct patient to close lip around the bite block. Tongue not placed against hard palate cause air space visible and soft tissue shadow. Although failure to position the tongue on the roof of the mouth is one of the most common patient positioning error. To correct this error, the patient must be instructed to swallow once and to hold the tongue against the hard palate during the exposure. Spine slouched. Patient is not standing or sitting as tall as possible with shoulder relaxed. The cervical spine appears as radial opacity in the center of image and obscure diagnostic information. To prevent such an error, the clinician must instruct the patient to stand on side as tall as possible with straight back. An additional instruction to the patient may include step forward slightly, closer to the machine. This movement has the effect of straightening the cervical spine. Ghost image: if all metallic or dense objects like eyeglasses, earrings, necklace, intraoral and extraoral piercing, removable partial denture, or orthodontic retainers, hearing aids are not removed before the exposure of a panoramic receptor, a ghost image result that may obscure diagnostic information. A ghost image, which is a radio-opaque artifact seen on a panoramic image, is produced when a thick, dense subject is located outside of the focal plane and close to the X-ray sources. To avoid a ghost image artifact, the dental radiographer must instruct the patient to remove all dense objects in the head and neck region before positioning the patient for panoramic radiography. Teeth are arranged in a smile-like curve. Crown and apices of all teeth visible. Ramus should be the same width on each side. Cervical spine may be present along edges, but should not overlap the ramus. Has palate double image appears above the apices of the maxillary teeth. Inferior border of mandible appears smooth and continuous. Condyle is center, is of equal size on each side, and is on the same horizontal plane. Hyoid bone double image appears. Hyoid bone may slightly overlap mandible.